you actually wear different hats. Clinical pharmacist on one hand, the other hand, personal trainer. Two different worlds. So what got you from there? Maybe you can kind of help the viewers to understand that trajectory, that journey, that how did you starting to kind of say, you know what, that's what I want to do. And that's my passion now, to be a personal trainer. And now you're also a public speaker.
Yes. So, and it's, I get that question a lot, right? People are like, how do you connect these? But funny enough, I'll explain it, and I think you'll see that they're actually very connected. So I've been in healthcare for decades. That's what I do full time, and it's my passion. I work with people with their chronic conditions, with their health, with everything. And I've always done education that way, whether it was for groups, for my colleagues. So that always came naturally, that desire and joy to learn and to share. And I think, each of us has our different categories. And I'm so grateful for the people that share and educate me on all of the things I don't know. So the healthcare was always there. And over the years, it's been really nice that in healthcare, we've started to focus more on preventative medicine, right? So now you'll go to a conference, a medical conference, and instead of just seeing booth after booth of drug sales, you'll see, a keynote speaker talking about the exercise prescription and how, did you know that 10 minutes of a brisk walk 3 days a week, after several weeks, people had reported improved scores on their PHQ-9, their GAD. These are questionnaires for self-assessed anxiety and depression symptoms as part of the diagnosis process. So, something like walking outside is so powerful. And as I learned, I would talk to patients about exercise for their blood pressure lowering effects, for their insulin resistance, for their mental health. And I realized that a lot of people just didn't know how. They weren't motivated because they were like, okay, well, I don't really like to exercise. How am I going to start? And from there. So I thought, well, if we can spend a lot of focus on getting people to enjoy group fitness classes, or these sessions with the city on healthy eating and these types of things, then they are less likely to need a more intensive healthcare in their journey. So I've become really an advocate for non-pharmacological and holistic approach to health, which can hopefully prevent people from or at least delay or reduce the risk of chronic conditions.